Hello and welcome to Differential Discussions. I'm Melissa,
And I'm Dave,
and we're back with another of our Serous fluids.
your favorite morphologist, looking
Mhm.
at body fluids.
Yep.
So, yeah, we've done a decent amount of serous fluid so far.
Yep.
We're on our low power, like we like to start, and we're looking around. I always like to look for clumps, right? And there's like small clumps that are probably going to be consistent with like lining cells and things,
Mm.
but we don't know that
Yep.
until we look at them. But like I see like this kind of stuff.
Yeah, they look mononuclear.
Yes. Yep. So we'll see when we get in closer, but nothing that's super standing out to me as weird.
Yep. Let me move around a little bit, see what else we get.
Hmm.
Some more darker colors there.
Hmm.
We'll see.
Yeah, so darker could mean like scary things, or sometimes it
Yes.
could just mean, um, yeah. So I think where it's darker and clumped to a point where it starts to get like a height and a depth to it, you worry about
Yep.
like tumors. Um,
I mean, it could just be that there's a nice clump of cells there. It could be there's some kind of fiber, junk, mucoid,
yeah, yeah,
stringy,
yeah,
fibrin strand. I mean, depends.
yeah, it does depend. Yep.
So we'll take a look as we scroll on through. Ooh,
Yeah, body fluid
look at
slides are
that
always a
one.
little bit, yeah, that's a big sucker.
Wow, that's
Yep.
huge and dark and ugly.
Yeah.
Okay.
A couple
So
of dark.
mostly it's just those clumps of mononuclear looking cells.
Hmm.
I want to go back and find that really dark cell.
Yeah, it might be a good one to look at first.
There's a couple. I saw a couple darker ones down here too. I
Hmm.
was trying to find the one dark one that we saw earlier. Is that it? Yeah, that's it. Okay,
Yeah, I
I'm
think
gonna
so.
drop down.
Yep. So in terms of like normal physiology for like big dark cells like this, you can definitely have in inflammatory conditions, a reactive mesothelial type picture. Um, Yikes.
I'm going down.
Yeah.
It's
Yeah.
easy.
So for me, this is like Path City.
Yeah. Yeah. It's actually, let me see if I can
Maybe if we bring the light up a little. Yeah.
a little bit. It's binucleate.
Okay. Oh, I can actually start to see the outline here.
Yeah, there's
Is
one
there something?
here and
Okay.
there's one here. This is not part of the nucleus, but it's a darker area.
So in scope, this looks a little better. Is that basically
It
what you're
doesn't
saying?
look quite as menacing. It
Okay.
still is something that I would question and probably send to path.
Okay. Yeah. So if we could then just think about it from how the viewer sees this, right? So if you ever see like a cell like this, where you can't determine where cytoplasm ends and begins, where the
Yeah.
nucleus ends and begins, that can be like troubling. So the way in which cells stain is, of course, dependent on the stain.
Hmm.
So a lot of people will like remake slide. I've seen people make what like they're just over and over again, just making slides and expecting different outcomes. Um, this stain and the preparation is QC'd right here, right? We can see normal hematopoietic cells that are staining the way that I would expect them to stain. I can even see like a little beat up red cell here. So I'm seeing all parts of the right stain behaving exactly the way I want it to behave. And then you have this right next to it that's just this mess. Remaking the slide's not going to do anything, right?
Right.
This is a finding and you should deal with it.
Well, the other thing about remaking slides is when you remake them with body fluids, you may not get the same layout of cells, the same distribution of cells. You may not get that really wonky, ugly looking cell on your new smear. And so restaining it, you might not get to see if it was the stain because maybe there's only one or two on us on this slide, and maybe you have to make like 5 more slides to get something like this to be on your smear again, which we're not going to make like 5 slides unless we're trying to make an educational batch of slides. And so there's really no point in remaking it unless it's for sure staying. And like Dave, you said, we know it's not because of these other cells over here.
Yeah, that's an excellent point, and I think it's a thing that some texts tend to do is you're really putting your finger on the scale and getting rid of the objectivity that we're supposed to
Right.
represent when you do like Melissa was saying. Like
Yep.
it's just not good practice.
Yeah. I mean, the other thing with this cell is we can compare it to surrounding cells. We saw a lot of these mononuclear cells. So if we move, we're probably going to see some more of them. And if this one's huge and ugly and dark and the rest are all fine, then maybe it's just this one cell that needs to be path reviewed. And the rest of the cells we can lump into monos or macrophages or mesothelial cells.
Yep, right.
So let's look around and see what else we can drag
Mhm.
in. There's actually there's a nice batch up here that I want to show you
Oh, cool.
with
Perfect.
little blebs, but there's another really nice batch down here.
Ah, wonderful.
Gorgeous.
Yeah, so we got a nice like window, which is
Mhm.
good, nice healthy window. And this may be like a binucleate, right? Which is totally cool for mesothelials, or it could be just 3 distinct cells, but just a perfect example of what normal mesothelial tissue should look like. Yeah,
Yep.
it's cool.
Yeah. So yeah, so that big one is concerning
Mhm.
because that's well, so far, that's the only big ugly one that we've seen, and these mesos look like this.
Yeah,
Cute, fuzzy, light coloration. Ooh, yeah, look.
yep.
Lots of
So
cute ones.
a lot of meso cells, it looks like, for the most part.
Yeah.
And
So, Dave, I have a question. Why are they not plasma cells, especially this guy up here?
yeah. Yeah, and I think um it's not a bad place for a morphologist to go. Like someone who's like a student and like learning, and maybe especially early on in body fluid training, that's not a bad place for your mind to go. But so what's telling me it's not a plasma cell is the NC ratio a bit. Um, Also with a plasma cell, there should be a very well-defined perinuclear halo. So, um, like if I focus on this particular meso here, because I think this is a good April Fool's plasma cell, right?
Yeah.
So generally speaking, a lot of things I like to look for good plasma cell morphology is an eccentric nucleus, which it is a bit eccentric, which is neat. Um, you want some kind of a perinuclear halo, which I would argue this does not have. The reason why I don't believe it's a perinuclear halo, so someone might point to the differential in color between, here and here. And I would acknowledge that there is a differential in color. The problem is a perinuclear halo is never going to go continuously all the way around the nucleus. So that's actually inconsistent. And then knowing what we know, this is more consistent with a fried egg appearance of a mesothelial cell. So, uh, you know, I think for many of those reasons, like it's not. Some other trickier calls, like this is probably one of the maybe a little bit closer to looking like a possible plasma cell, but again, it fails the perinuclear halo check. It's got a rough kind of outline to it, which is more consistent with a tissue cell than it is with plasma cells. Um,
Well, that one
yeah,
also looks like it's partnered with these 3 here. Like it looks like this is the window
yep, yep.
for those 2. And plasma cells don't partner. They don't have windows. They're not attached to each other.
Exactly. So the function of a plasma cell, it will never be, will they be close and adjacent to another one? Is there malignancies where it's possible that you're catching like mitotic kind of transition where there's cell replication and things like that? Suppose so, but there's just so many things. And then the biggest thing, honestly, the biggest thing is the chromatin pattern just is totally inconsistent with the plasma cell.
Yep.
So I try to hit the easy things first because chromatin is like really tricky. I think at the level where you as a morphologist are looking at chromatin in a thoughtful way, you're like really, that's high level of competency.
Mm.
But the chromatin pattern on mesothelial cells is such that I don't want to say they're immature looking, but they never look fully mature in the way that hematopoietic tissue, when it matures, is clumped. So plasma cells frequently have sort of similar to like a CLL lymph,
The white
like a soccer ball.
striations. Yeah.
Yes, yes, yeah,
Yeah, and like the textbook plasma cell, which you almost never see, but the textbook will show you like the white striations
yeah,
radiating out kind of like this from the nucleus
yeah.
all throughout. That's the typical kind of plasmacytoid nuclei chromatin pattern we'd be looking for. And yeah, this one's nothing. Like I
Totally
think
absent.
for me that's the one of the biggest things because I mean, sometimes see how the edges are darker here and the inside's a little bit lighter. If there were a perinuclear halo, kind of like this with it, and then you still had the separation of color here, that could be a plasma cell because sometimes plasma cells will have a little bit lighter on the inside next to the HOF and then a little bit darker, especially when they're actively producing a lot of immunoglobulins. You'll have a lot more darker coloration. So it, the cytoplasm could look plasmacytoidy here. I think the difference again being the rough edge and the lack of the perinuclear HOF. But I mean, then even if you're looking at a malignant plasma cell, it can do what it wants.
And they can have really wacky cytoplasms too, right?
Yes.
Start to
And
get.
I think that's a different bag of worms.
Yeah, it is. It really is. But yeah, the size of the nucleus, the chromatin pattern, honestly, the nucleus is just completely inconsistent with a plasma cell.
Yeah.
And it's tough to like put it into words.
Yes.
But yeah, it's just reflexive to me. And I'll see this on occasion. I find myself to be like a Reddit lurker, and people will post stuff like this. And I actually had a situation where I had a little discussion with someone online that thought that they were a plasma cell. And it's definitely, if you're inexperienced,
Yeah.
I get it.
Yep.
But the nucleus is just completely not
Yeah.
plasma celly. Yeah.
All right, let's keep going. See what
Great
else we
learning
can find.
opportunity.
Oh, look, there's a binucleate one.
Yeah, there's another clue too. I haven't seen too many binucleated plasma cells, but yeah, and
Not normally.
right, yeah, right. That's a fair point. Um, but yeah, and the other thing, like, it's just so like perfect. Like the nuclear contour.
Hmm.
I love mesothelials.
Yeah, that one's really pretty.
It's very pretty cells.
And look, it's right next to a macrophage. This one is.
Yeah, this is cool too to be able to have a contrast like this.
Hmm.
Um, so like, there becomes some degree of difficulty in macrophages and mesothelial cells, especially with sufficiently like degenerated older
Yeah.
mesothelial cells. But there's a good contrast there.
Let's see. I think the other thing that's important to note is that, like you said earlier, we've looked at a bunch of serous fluids, and throughout the different serous fluids, the mesothelial cells look slightly different from patient to
Here.
patient.
Yeah.
So the other thing is you have to get acquainted with this patient's cells.
Yeah.
So
Yeah.
sit down, scan, look around, become comfortable with the cells, and then do your differential so that you can say, oh, these are this patient's mesothelial cells. This is this patient's macrophages.
This mesothelial cell is like the meanest for like a practical exam. Like if you were to make make an exam to purposely stump a student, not a plasma cell, definitely a mesothelial cell.
Yep. Oh, there's a couple more over here like this.
Yeah, this has really, really good mesos. So we saw like a couple of like concerning splotches on video. But for the most part, this is like a pretty normal sort of serous fluid.
Yeah.
I think you said is it ascites?
Yeah.
The source. Yeah, I'd say that this is very, very consistent with some kind of a garden variety of fusion in terms as far as like people get or one would get in a fusion.
Mm-hmm. Yeah. Let me move around a little bit.
Sure.
I think too, the other thing is there's so many mesothelial cells here. I think I would put it for path review just because of the sheer number of mesothelial cells,
Yeah,
with concern of maybe even something like mesothelioma or just too many mesos. I
sure.
definitely want a path to look at it.
Yeah, I think it, even for that one or two like those dark like
Yeah.
clumps, it's good enough for me to have the
Yep.
path look at it. Absolutely.
Yeah. But
Um,
even without those clumps, I would
yeah,
probably send it because of the number.
yeah, yeah. Whatever the SLP, right?
Yep.
Um,
Ooh, there's a basil up here. I'm coming up to find him. Basil, right there.
cool. And I'm looking at like this, and that's like I don't
Oh
know.
yeah. Yeah, let me bring them a little bit closer. There we are.
So yeah, it's really tough to know what's going on here. Sometimes it's just a circumstance of the junk, and
Yeah,
but you can't tell what that is, right?
right.
So
Yeah,
could be something really bad.
yeah. There's not a lot of that, but if there's
No, there
enough,
isn't. Yep,
even even one or two, it should go
yep,
for a review. But
yep.
yeah,
Yeah,
there's a ton.
to sign out a diff and to not use the path review is to say that you are confident in the normal findings, right? So,
This one's got
um,
a really nice window up here.
oh yeah, that's awesome. Yeah, so you can see the division of the cell there. And we've had like lots of neutrophils. There's been the occasional monocytes. We're not really commenting on
Yep.
limbs. So, um, we're trying to focus on the exciting stuff, I guess.
Yeah. All right, I'll move again, just one more time, see what we find. Just more mesos.
That's a lot. I mean, honestly, sometimes, when you're not actively counting, but it's like probably almost definitely over 30%, maybe
Yeah.
50% are like mesos. Yeah.
Yeah.
Yeah, it's a lot.
Yeah, and this meso, look, it's large, not as large as that big ugly one we saw at the beginning. It's got two nuclei, which is not concerning. A huge prominent nucleoli in each one of them, too.
Yeah. It's beautiful cells.
Hmm. Okay. Well, I think we saw everything we're gonna see on this slide.
Yep. I think it delivered.
Yeah. All right. Well, thanks for watching.
Thank you for your time.